A very good morning to you all. Om Sai Ram. At the outset, I'd like to thank the organizing committee of the Global Healthcare Summit for the honor of this invitation to participate in this summit and to deliver a talk on cardiac surgery capacity to manage congenital heart surgery in Asia. My name is Krishna Iyer, and I am from the Pediatric and Congenital Heart Surgery Department at the Fortis Escorts Heart Institute in New Delhi, India. When we talk about Asia, Asia is the world's most populous continent, constituting roughly 60% of the world's population. It encompasses roughly 50 countries, and so it's further subdivided into various subdivisions like Central Asia, North Asia, Southeast Asia, depicted here with different color codings here. The different countries have varying levels of development as well as economic strength. As you can see from this color-coded chart again, there are a few countries which fall into the developed or the very rich category. The countries like Japan, South Korea, Saudi Arabia, Singapore, and Hong Kong. And on the other end, there are extremely poor countries like Afghanistan and Yemen. But the majority of the countries fall in the so-called low or middle income countries. And so our discussion will focus mainly on the problems associated with congenital heart care in these low middle income countries. Now, commensurate with this large population, it's also evident that the majority of the congenital heart disease patients born in the world are born in Asia. And of the roughly 1.3 million children born with congenital heart disease every year, approximately a little more than half of them are born in Asia itself. So Asia carries a huge burden of congenital heart disease, and thereby the problems associated with this are also very significant. If you just look at the capacity of cardiac, especially pediatric cardiac surgery in Asia as compared to the rest of the world, now, this is a map showing the distribution of pediatric cardiac surgeons per million population taken from the CTS net registry. You can see that in Asia, the availability of pediatric cardiac surgeons is between 0 and zero point 0.5 per million population, compared to the developed countries where the ratio is more than 2 per million. And therefore, this is a significant deficiency in capacity for delivery of surgery for congenital heart disease within Asia. Ashish Kateva in 2021 published an interesting study in the Indian Journal of Cardiovascular Surgery, where he analyzed the availability, access, and funding across 193 countries for surgery for congenital heart disease. And he analyzed two aspects. One was the availability and access, and the second was funding. And he categorized the countries in these following categories. With availability and access, it was divided into the best, which was triple A, where there's excellent pediatric cardiac surgery available and accessible to all children. And the worst was there was no pediatric cardiac surgery available, labeled as NAO. And as far as the funding patterns, again, the best being GOO, where all expenses for congenital heart surgery were funded by government or employer insurance. And the worst being where only humanitarian missions provided cardiac care in these countries. And when you distributed the countries, when we focus on countries from Asia, we see that there are few countries which fall into the best category where congenital heart surgery is available for all children born with it, and it is supported by government or insurance. And these countries are Israel, Japan, Qatar, South Korea, Saudi Arabia, Singapore. So of the 50 countries, there are about 6 or 7 countries which fall into this category. And the other extent where congenital heart surgery is available only in a limited fashion or available through humanitarian organizations or visiting traveling teams. And these are countries like Mongolia, Uzbekistan, Afghanistan, Myanmar, etc. These form into the other extent. And there are about 7 or 8 countries which fall into this category. But the vast majority of the categories fall into this middle group where congenital heart surgery is available to a variable extent, some offering very high end, but with a limited capacity. And therefore, most of the population of congenital heart disease is not served. But however, there is variable amount of access and availability to congenital heart surgery. And the most populous nations of India and China fall into this category, including Indonesia, Iran, Thailand, Vietnam, and Malaysia. All these countries are the ones where congenital heart surgery is available to variable extent, but it definitely does not cover the entire population that needs it. Early this year, the Indian Journal of Thoracic and Cardiovascular Surgery brought out a thematic issue on congenital heart disease, focusing on pediatric cardiac surgery in low middle income countries, which was guest edited by myself and my colleague Sivakumar Sevalingam from Malaysia. And this issue focused on the challenges as well as the availability and access for surgery for congenital heart disease in LMICs. And since most of the Asian countries fall into this LMIC group, this issue became a very relevant issue for this talk. And therefore, a lot of the material that I have presented in this talk will be what has been extracted from this issue. The first article in this issue was by Bistra Zeleva from the Children's Heart Link, addressing the issue of global inequity in congenital heart care across the world and addressing the issue as to why there is substantial deficiency in the provision of care for children with congenital heart disease in LMICs. And broadly, the reasons could be divided into two major issues: economic and financial factors on one side, and health system factors on the other. And we'll look at the financial. Obviously, the important issue that comes up is the cost of delivery of pediatric cardiac care, the missing advocacy, and the fact that the government priorities do not take congenital heart disease as a priority, and therefore there's poor healthcare financing for this area. On the other hand, there is lack of awareness, and there are huge gaps in research as well as available data, which results in bureaucratic and political inaction, and therefore translates into the fact that there is limited specialist healthcare workforce and there are major infrastructure gaps. And obviously, to improve the situation, one has to reverse many of these shortcomings. One has to make efforts to make congenital heart disease a public healthcare priority, which will then translate into financial modes which are sustainable, being evolved. And a focus has to be on trying to emphasize the economic and social benefits from caring for these children appropriately and appropriate timely. On the other hand, raising awareness and growing political will becomes a part of this entire exercise, which will then further translate into building capacity in terms of manpower as well as infrastructure. And all this, of course, is based on advocacy for policy action. Now, let's go and look at the status of congenital heart surgery in certain select Asian countries. Again, when we curated this issue of the Indian Journal of Cardiovascular and Thoracic Surgery, we had invited prominent surgeons and cardiologists from many of the LMIC countries to analyze and write up the status of congenital heart surgery in their respective countries. So that was useful data, which I will be presenting subsequently in my presentation. So starting with India, India being the world's most populous country with a population exceeding 1.45 billion, and gradually it has become the fifth largest economy in the world, although because of its population, the GDP per capita is only less than $3,000. And this reflects in the fact that there are major deficiencies in the care for children with congenital heart disease. As far as the prevalence of congenital heart disease is concerned, it's estimated that about 170 to 220,000 children are born with CHD every year. About 30 to 50,000 of these infants would require surgery in the first year of life. And overall, there's a population of about 2 to 4 million patients with congenital heart disease at any one particular point of time in the country. And although congenital heart surgery started way back in the 1950s in small aliquots, but the progress of cardiac surgery, and especially congenital heart surgery, was extremely slow in the latter half of the 20th century. And it was only in the 21st century that gradually more and more pediatric centers began to be set up across the country. And now we can say that there are more than 100 centers which provide high quality congenital heart surgery across the country. These are just three maps of India showing A on the left, the volume of cases in each center. And you can see that there are quite a few centers which do more than 1,000 cases per year. In the middle is centers which are either purely pediatric or mixed, which means they do both pediatric and adult. And the last one, which shows that the majority of these centers are in the private setup rather than in the public setup. There are fewer centers which provide congenital heart surgery in the public setup. And there are various types of hospitals that provide congenital heart surgery. A good proportion of it is in the corporate hospitals, which are the corporate healthcare chains. Some in the public teaching hospitals, like the All India Institutes and the postgraduate institutes across the country. Some state medical colleges do provide congenital heart surgery. There are quite a few charitable trusts. And lastly, there are interestingly free philanthropic hospitals. And this particular institutions, the Satya Sai Sanjeevani hospitals, are the largest bulk of the hospitals which provide free heart care for congenital heart surgery, which is something which is very unique to our country and is probably not seen anywhere else in the world. But most of the high volume centers provide a complete range of congenital heart surgery, starting from neonates to adult congenital heart surgery, with outcomes that are comparable to international standards. And then again, the sources of funding are extremely variable. Quite a few patients are self-pay. That means the parents pay out of pocket. And therefore, costing of congenital heart surgery becomes an important issue because obviously the capacity for individuals to pay for surgery is limited to some extent. Insurance has not made major inroads into healthcare in India, and especially for congenital heart disease, because individual insurance policies do not cover congenital heart disease, and it's only corporate or group insurance scheme which cover congenital heart disease. Employees of the government can avail of central government health services. Then many of the states have government schemes which support congenital heart surgery for patients who are either poor or can't afford the surgery. And these are dependent upon what the state's capacity is to support these schemes, but they are increasingly becoming popular and do serve a large population of patients with congenital heart disease who really can't afford to go to private hospitals. There are many NGOs and philanthropic organizations. The international funds like the Rotary Gift of Life also contribute to care of a certain proportion of patients. Crowdfunding is increasingly popular. And in India, there is a system of corporate social responsibility where companies are expected to put a certain amount of their profits every year into corporate social responsibility. And so there are many schemes which derive funds from these CSR activities. And so over the last 3 decades, we have seen a steady growth in pediatric cardiac surgeries and pediatric cardiac units providing pediatric cardiac care. You can see that if you look at surgeries alone, which was hovering in the range of 6,000 to 6,500 in 2009, in 2024 now, we've done approximately 40,000 cardiac surgeries per annum. So it's a substantial jump in the number of surgeries and the amount of care, which has also been because there's been a significant increase in the number of healthcare personnel involved in this specialty. But again, given the burden of the problem, this is certainly not enough. Dr. Anita Saxena, in a write-up in 2018, giving a status report, did conclude that there's a huge disparity in supply and demand for congenital heart surgery in our country, and only about 1 in 6 children with congenital heart disease do manage to get timely and appropriate treatment. In addition, there's a wide variation in reasonable availability of pediatric cardiac care. The majority of the care is in the private sector and therefore expensive. Clustering of centers in metro cities add to this problem, and there are very few facilities available in the rural areas or in the portions of the country which are remote from metro cities. And these translate into multiple hindrances to the delivery of equitable care. And if you just look at the projected demand for both healthcare personnel to deliver universal coverage, you can see that the requirement is about 8 to 10 times what is currently there. So there's a huge need for capacity building if one has to consider universal coverage in India. Nevertheless, the positive aspect is that most of the high volume centers deliver care with extremely high quality. If you look at our own center, the mortality for congenital heart disease has been less than 2% with a steady result over the last 20 years. At the same time, it's an interesting fact that although we are unable to meet the demands of our own country, but India is a major destination for medical tourism for congenital heart surgery. Many patients come from countries as far as Africa, Iraq, Afghanistan, Turkmenistan, the former CIS countries, for congenital heart surgery in India because it's both affordable as well as accessible. And so you can see this picture from our unit at one particular time. There were patients from at least 7 different countries, which are geographically far flung, but that's an interesting aspect of congenital heart care in India. Moving on to Malaysia. Malaysia is a country where the population is about 35 million and the incidence of congenital heart disease is approximately 5,000 per year. As you can see from the map, it's divided into two areas. One is in the mainland and another is part of the island groups of Indonesia. Surgical facilities for congenital heart disease are rapidly increasing, and the main center for CHD surgery is the National Heart Institute or the Institute Jantung Negara in Kuala Lumpur, where the maximum number of surgeries are performed and covering the entire range of congenital heart surgery. It's the most advanced center for the country, and it's also was set up with assistance from Children's Heart Link. They do about 800 to 900 cases per year. About 250 to 450 cases are done in government hospital under the Ministry of Health, and a short, small number of cases in other hospitals. So you can see of a load of about 5,000 cases, they are able to operate in about 1,500 cases per year, which still means that there's a substantial gap between the supply and demand. Funding is largely by government referral, 30% through private insurance, and 10% are self-pay or overseas patients. And this is data from Iyer et al. From the same issue that I mentioned. The clinical outcomes are extremely good. They put their data on the ICIQ, and this is data derived from that. The last 694 patients that were analyzed, the mortality in hospital mortality was 2.5% with a low incidence of complications. If you look at Indonesia, Indonesia is an interesting example because it's a country with over 17,000 islands. It has a population of 270 million. And this is the chart which shows the distribution of congenital heart surgeons. There are approximately 18 congenital heart surgeons across the country, but you can see that the main concentration, about 11 of them, are in Jakarta itself. So there are only a handful spread across the rest of the country. The incidence of congenital heart disease is approximately 50,000 per year, but only about 5,000 of these get treatment per year. 50% of them surgery. There's approximately 2,500 surgeries and 2,500 interventions for the year. So you can see compared to a demand of 50,000 per year, it's a small amount that is actually being treated. And the main challenges are that there is a significant lack of human and medical resources. There's lack of training centers within Indonesia, and most of the healthcare personnel need to go overseas for specialist training in congenital heart disease. And it's a long gestation period for cardiothoracic surgeon training in congenital heart surgery. The uneven distribution of CHD centers, as pointed out, most of the centers are in Jakarta or in and around. And being a country with so many islands, access is extremely difficult. And of course, there are lack of financial resources. And although the patients are covered under government health insurance, but the payout from the health insurance is quite insufficient to the costs, to cover the costs in the care of congenital heart surgery, especially when it comes to complex cases. And as a result, the hospital end up with low salaries for doctors as well as healthcare personnel. And this becomes a major disincentive for both doctors as well as healthcare personnel to take up this specialty. So it becomes a vicious cycle where a small amount of healthcare providers have to face a large burden of congenital heart disease and are certainly unable to meet the demand. Moving on to Thailand again. Thailand has a population of 70 million with 76 provinces within it. For healthcare, it's divided into 13 health zones, and the incidence of congenital heart disease is about 5 to 6,000 per year. There are about 55 surgeons performing congenital heart surgery, but again, as you can see, the majority of the surgeons, roughly half of these, are situated within the capital city of Bangkok and the surrounding areas. So most of the rest of the country has very few centers for congenital heart surgery and very few surgeons also. And although they have about 35 or so units which perform cardiac surgery, as you can see, but this is including those which perform just 5 congenital heart surgery cases per year. The majority of them, as you can see, are in the public sector. There are very few private hospitals which provide surgery for congenital heart disease. And the total in a year is approximately 2,500 surgeries. Again, the vast majority, about 2,200 in public hospitals and very few in the private hospitals. Going on to Vietnam, as you can see from the map, Vietnam is a geographically very interesting country. It's actually a huge, long strip of land uh, comprising of North Vietnam, southern Vietnam, which are the more populous, and a very long strip of central Vietnam. Accordingly, the healthcare is mal-distributed because of this geographical scenario. It has a population of about 100 million. The per capita income is approximately 4,300 US dollars. And the number of CHD is approximately 14,000 per year. The total number of surgeries performed for CHD approximates about 5,000 cases done in 15 centers across the country. The number of pediatric cardiac surgeons is 27. And this is a sort of list of the various centers which perform congenital heart surgery, along with the number of cases they perform. As you can see, the most busy center is the Vietnam National Children's Hospital right at the bottom, which performs as many as 1,250 cases per year. But most of these centers, apart from 3, which are large volume, most of them are small volume centers. In Pakistan, moving on, Pakistan is again as a geographical location which affects its care for surgery for congenital heart disease. As you can see from this map, the dark markers are location and number of congenital heart centers. You can see that most of them are concentrated in the state of Punjab. And if you go westwards, you can see that the entire region of Baluchistan is devoid of any congenital heart surgery centers. So Pakistan has a population of 270 million. New incidence or case report, according to this article, is 2,200 per year, but I think that's an underestimation. There are about 20 cardiac centers performing CHD surgery, with only 3 being high volume, with marked disparity in geographical distribution. And Punjab, which is the main state, 50% of the centers are located in Punjab, whereas mentioned Balochistan, which lies to the west, has no centers. Healthcare funding remains a major challenge along with manpower and social challenges, according to Malik et al. From this article. I'll just briefly mention Russia and China because there's not much material available as far as the overall access and availability of congenital heart surgery. But this is what Google AI states. Congenital heart surgery in Russia has developed significantly with modern surgical techniques now available, although access and volume can still be issues. Key centers like the Bakulev National Medical Research Center in Moscow are well known, and international collaborations have helped establish and improve programs in other cities like St. Petersburg and Tomsk. While outcomes can be comparable to international standards, the overall number of procedures may still be insufficient to meet the population's needs. And likewise in China, the key facts about congenital heart surgery in China are that there's approximately 100,000 newborns born with congenital heart disease annually in China. And there are as many as 700 pediatric cardiac surgery facilities performing a large number of operations annually. The leading centers are the Fuwai Hospital in Beijing and the Shanghai Children's Medical Center in Shanghai. They are amongst the largest and high volume centers. But there is major regional disparity in China being a vast geographical area. Access to and quality of care are better in the economically developed coastal areas compared to the rural and inland regions. And the challenges are that there are insufficient number of pediatric cardiac surgeons with a high burden of disease in a populous country. A lack of cohesive pediatric cardiology teams in many centers is an obstacle. Inadequate collaboration between hospitals can lead to poor treatment for patients with coexisting conditions. So, to summarize, Asia is a vast continent with a vast disparity amongst constituent countries with regards to development and healthcare. Most countries belong to the low middle income country category, where care for CHD remains challenging. Nevertheless, most countries are making steady progress in the availability and access to congenital heart disease surgery. And awareness, advocacy, and coordinated efforts from all stakeholders is key to continued improvement in care for children born with CHD in Asia. Thank you for your attention. Saira.